Good morning or good afternoon, everyone. Welcome to our fourth iteration of our Stanford Medicine Town Hall. My name is Andra Blomkantz. I'm the Chair of Emergency Medicine, and I'll be moderating today's session. First of all, since we're now about 3 weeks into the shelter in place and everybody's been getting used to staying at home, I wanted to ask our individual leaders to briefly introduce themselves and then tell us what's top of mind for you today or this week.
Good morning, everyone. My name is Paul King. I'm the CEO of our Children's Hospital. And what's top of mind for me is really your safety. We've been really concerned as a leadership team in terms of making sure that we're committed to your safety, to make sure that you have the proper personal protective equipment you need to protect yourself and our patients. And so that's something that's really been sort of top of mind for me. The other thing is, when I think about the crisis that we've faced collectively, this is a time in history that will change us all forever. And when we think about that, that's pretty amazing. It's going to change the way we treat our patients, change the way we take care of ourselves, and change the way we take care of each other. And then finally, as leaders, we're called upon to do our best to help you do your best. And when we think about having to be here in the now in terms of treating today's crises, we also have to look forward to a future where we'll be on the other side of this crisis, stronger and changed.
Well, good morning, everyone. It's great to be here with you. I also want to say I'm David Entwistle, the CEO of the Adult Hospital. As I think about what's top of mind for me, I first of all want to continue to say thank you for the incredible work that the teams are doing. I know that we don't get to come and say that in person often enough, and as we think about what we're all doing and the many different factors, whether we're at home working, whether we're here in the hospital working, or in our many clinics, I just want to say thanks for the great work that's going on. I also want to give a special shout out to our team in facilities, as we have been working through some of what can we do to plan for what potentially could be a surge in the patients that we're seeing. We began to realize pretty quickly that let's take advantage of all the resources that we have here. We had the opportunity to open this great hospital that we're in, but we also have some additional units that were actually being prepped for remodel, both on the D1 and D2 units. In fact, they had been decommissioned, which meant that we took the equipment out of them already. Well, we made the decision as a team to pull those units back online to have additional capacity. And when I say a shout out, literally in 11 days, the team was able to get those units back in order to both have acute care beds, but also ICU beds. And so it's amazing to see what we can do on very short notice when we need to do that and have that additional capacity for the teams. As we also think about the fact that we are actually here for our community, we're here to make sure that the individuals that rely on us for services, that we're here to be able to provide that space. And it's great to see that we were able to bring those units back online and have the kind of capacity that we'll need to care for our community. Amazing work.
Thank you. I was seeing patients earlier this week, and it came to mind that the notion of a provider having the mask and the shield and the gloves and the gown must be really intimidating for patients. And we've fortunately in the emergency department now been able to capitalize on our movement in digital health and use iPads outside the room to be able to engage the patient, see their face, have them see our face of concern and genuine concern for their well-being, and then do the mask and the goggles and the gloves and the gown. And I think that's a really important part of this, because I can only imagine how intimidating it must be for patients not only to watch the news, but to have those people walk into the room.
Thank you, Andra. I'm Lloyd Miner, Dean of Medicine, and I want to begin by following up on the theme that Andra just mentioned and actually start by thanking Andra and her colleagues, our colleagues, the chairs of the clinical departments in Stanford Medicine for the great work that they're doing, working with all of us to make sure we're providing outstanding patient care and that we're doing the research that will enable us to ultimately control and eradicate this virus. As David and Paul have said, we just can't be more inspired by each of you given the work that you're doing every day. And your safety, your well-being is absolutely our top priority. And we can't reaffirm that enough. But we're doing it every day through the work in occupational health, through the services that we're providing for those who need additional help with child care, for the care that we're providing for those in our workforce who have become infected with the virus from community spread, from any other source. We want to reaffirm to you our commitment to your health and to your well-being in every way that we can. I also think about the global consequences of this crisis and the pandemic. The life of every American has been affected by COVID-19 over these past several weeks, and indeed the lives of people around the world are affected. We know that these effects are going to continue for a while. We're still uncertain as to how long they will occur, but this is not a sprint. This is going to be a marathon for all of us. And to follow up on a theme that Andra mentioned, I want to particularly thank the people in our IT departments working with physicians and other healthcare providers to rapidly scale up our ability to do virtual visits, to rapidly scale up our ability to connect to people remotely and in meaningful ways. As David mentioned in a town hall a few weeks ago, during the entire month of February, we did about 1,000 virtual visits in our adult healthcare delivery system. In one day last week, we did over 3,000 virtual visits. That's over 50-fold increase in a very short period of time. Lots of people have worked for hours scaling up that capacity rapidly and securely and in a way that enables healthcare providers to deliver the type of personal connection that we want to, but that we're challenged to in a physically connected way that we're challenged to do today. And I think that's going to be one of our continuing challenges in the weeks ahead. Our need to be connected has never been greater than it is today in the face of this pandemic and the challenges it poses for all of us. And yet, we have to, as you see today, remain physically separated in order to protect each other and in order to ultimately get control of the spread of this virus. And how we do that, I think, is going to be very important and a defining moment not only for us in Stanford Medicine, but for our society in a much larger sense. Thank you. Bonnie?
Thank you so much. And I'm Bonnie Maldonado, and I'm a professor of pediatrics, infectious diseases, and epidemiology here at the Stanford University School of Medicine. As I reflect back on the days since we've discovered this virus and learned more about the clinical manifestations, a little bit about how the virus itself works, and starting to learn about other aspects of this virus, I really want to bring myself back to understanding, as an academic medical faculty member, what is it that is it going to take for all of us to really do the work that it will take to build out the clinical studies and the laboratory-based studies and the population-based studies that we're going to need to really battle this virus in real time and in an effective way. And so I call out to all of you, because all of you are partners in this academic effort. We're in an academic institution, and we're all going to be participating as staff, as providers, in every way we can to do the right kinds of studies that it will take for us to develop rapidly ways to prevent this disease and ways to treat it. And I think that I'm hopeful that we're on the right path now, because we have really wonderful researchers, we have wonderful care providers, and I think together we will be able to get some answers very quickly about what might work for us in the not too distant future in terms of preventing and treating this disease.
Great. Thank you so much, Bonnie. So in keeping with our previous format of our previous town halls, what we've been able to do is get some pre-submitted questions from the previous announcement and cover some of those, and then try to, as quickly as possible, answer as many of your questions as possible. So I've got the first question. What can statistical modeling tell us about the trajectory of COVID-19 and the state of hospital resources? So this modeling is really, really important. Nigam Shah and Kristen Staudenmeyer have been doing excellent modeling over the course of the last several weeks to try to help us understand what the virus is going to do in our community. Now, of course, these are only predictions. They are predictions based on local county data and data within our own hospital. Now, what we know right now, and we monitor that on a several times a day basis, is that we feel that there'll be an increase in patients and a decrease in capacity in approximately mid-April. Now this could change hour by hour, and we reassess it every morning to try to titrate how we expend our resources and the things we need to do to keep people safe. But right now we're looking at that increase approximately mid-April, and as that modeling continues, we'll keep you aware of what that might be. So thank you. David, what are we doing to prepare for this surge in mid-April?
One of the things that I first of all want to do is thank our providers and our staff who have partnered with us as we're thinking through how do we prepare for what could be a large surge in capacity. We certainly see what's happened around the country and happening in other markets right now that certainly I think is concerning and probably causes a little bit of anxiety. Certainly we've seen what has happened outside of the country. I appreciate the fact that our teams have actually stepped up to make sure that we do have the capacity that we need should we have that surge as is anticipated. We have canceled and delayed all of our elective cases, which has created about a 50% capacity in our organization. If you think about it, we typically, in the 500P or in the main Stanford Palo Alto facility, we run about 600 beds. We're actually down to less than 300 of that. So we have that capacity that's now available. Similarly, in our Valley Care facility, and also what we're seeing at Stanford Children's, we have excess capacity that's available should we need it. Now, if that comes about, we certainly have the beds, both ICU, and we would have the acute care beds. And we actually are planning and coordinating right now with the county as well, and making sure that we understand what beds are available across the county. And we have not seen a large uptick in that volume. However, there is some that's current. But we do know that we have capacity that will be available should we need that. I'll also, and many others have shared about some of our telehealth activities. Not only have we worried about conservation of PPE, we talked a little bit about that last week, and we continue to have the stores that we need for that. But also the telehealth technology, should a surge occur, we also have the ability to be able to interact with our patients, not only to conserve that PPE, but also be able to have a face-to-face interaction with our patients. So there's a lot that's going into this planning. We continue to do a lot of things to make sure that we're available. As I mentioned, we've brought new units online. We continue to add additional in terms of our ventilator capacity, because as we see the disease progresses, needing that continued ICU capacity is important. But I can tell you we've got a lot of great resources, and because of what the teams have done, we feel as though we would be ready not only to respond for our own community, but also the coordination that we're doing across the county.
Okay, great. Lloyd, and as Bonnie mentioned, we're engaged in all sorts of research for this disease, both for prediction and cure. Can you tell us about the clinical trials that we're currently involved in?
Certainly. We've talked before here about the clinical trial of the drug remdesivir that is being used now in two different trials, one for patients with moderate disease, the other for patients with severe disease. Both those trials are moving forward. I know that Bonnie can give us an update on them. But I want to describe a couple of other areas too, and then turn it over to Bonnie, because she's very much at the front and center in bringing these trials to Stanford. There are antivirals that have been used for other purposes that perhaps were not as effective in other diseases that we're looking at bringing into early stage trials here. There are also new drugs that are about at the stage of an IND, investigational new drug trial, that the FDA has announced expanded and expedited review criteria for new drugs that may show promise in treating COVID-19. We've convened a task force, and Bonnie's very much a part in leading that, to look at how we can bring new clinical trials into our delivery system as quickly as is feasible, given the concerns appropriately about safety and about having the resources here to conduct the trials. Because we were one of the first places in the country to rapidly scale clinical testing, and we've tested over 8,000 people with our RT-PCR, we have a diagnostic system set up here that makes us ideally suited to launch and carry out these trials. Bonnie, why don't you tell us some more about the trials that you're involved in organizing and moving forward.
Yes, thank you. So Lloyd is correct, since I think because we're one of the first to launch our own PCR test, and by the way, we hope that we will have some serologic testing available in the near future as well. It gives us the capacity to really monitor patients, not only for immediate clinical care, but for clinical trials. We have we have remdesivir trials that are on the inpatient side now that are actively enrolling patients, 2 of them. We actually are starting 3 other clinical trials in the very near future, an interferon lambda study, and another study of a drug called chemostat, and the other one is favipiravir. They are viral inhibitors and immunomodulators as well. One of them is an immunomodulator, and the other 2 are viral inhibitors. They have been studied in other indications, so we think that we can obtain rapid FDA INDs so that we can start doing primarily outpatient trials for these drugs, so that if they work in reducing symptoms and perhaps preventing spread by reducing the viral shedding from an infected person, that these could be scaled up in the not too distant future. So we're hoping that those will enroll pretty quickly, and we're going to be looking to people like Andra to really help us partner in this research collaborative so that we can enroll patients that come to Stanford and treat them appropriately.
Okay, great. Thank you. I think it's pretty inspiring that we have now here at Stanford Medicine from people analyzing the data to try to determine risk profiles of patients as who will get worse, the diagnostic, now treatment, and then hopefully the cure. So I think it's really inspiring that we're working across this spectrum to try to combat this disease. Paul, what is Stanford Children's Health doing to help Stanford Medicine respond to this?
Thanks, Andra. First of all, I would like to recognize the amazing women and men at Stanford Children's Health who are doing the most important thing, and that's being here and making sure that we're available to take care of kids and expectant moms. So I think that's very important. The other thing, since this disease has not impacted kids as much as it has on adults, that doesn't mean that they're immune to the disease. So we have to be available to take care of those kids and moms who actually are contracted with the virus. The other thing we like to acknowledge right now is the amazing work being done in our birthing center. When we think about just the symbol that represents in terms of new life and joy and hope, that's an amazing thing during this very dark hour that we're faced with, that we're bringing 13 new little babies online every single day, and that brings us joy and gives us hope that there is light at the end of this tunnel. The other thing we're doing on the children's side is we're working with David and his team in terms of the surge planning. As we turn down our elective procedures, that helps us to preserve PPE, that helps us to preserve blood products, and that also helps us to reduce the volume of just people walking through the medical center in terms of potentially increasing spread with community acquisitions. When we think about what a children's hospital also does is we represent a referral site, not only for those community hospitals that may have pediatric cases that can be referred to us, freeing up their local capacity to take care of more adult patients. Lloyd mentioned earlier that we've seen a significant increase in our e-visits, as well as the number of our employees working from home. That too reduces community spread and just the number of people that are working through the organization. And then finally, David and I, our teams are working very closely together on a number of administrative policies and procedures around paid time off, child care, and safety procedures as well.
Okay, great. Lloyd, where are we with COVID testing, and what sort of plans does Stanford Medicine have for testing?
Yes. Well, we continue to increase the capacity of our internal RT-PCR. Additionally, through our pathology department and laboratory medicine here, we are engaging with 2 fairly early stage companies that have rapid diagnostics. And one of those, we have the device in-house today, and we'll be deploying it in the emergency department, I think, very soon. And the other, we're in the process of validating and also hopefully rolling it out, as well as a number of conversations with other companies that have point-of-care rapid diagnostic tests in the pipeline. We do want to continue to look at ways that we can scale our diagnostic testing. One of the things that's happened in the past couple of weeks in the Bay Area is that when we first started testing patients, which I believe was March the 4th, with our FDA-approved RT-PCR, we were doing the bulk of the testing of patients with suspected COVID-19 infection in the Bay Area. We were receiving samples every day, several times a day, from UCSF, from Kaiser, from Sutter. Now those systems, by and large, have their own RT-PCR testing-based capacity scaled up. And so that has allowed us to expand the type of testing that we do with our tests, since we have more capacity now, and also has allowed us to do things such as opening, and for those of you who've driven by the intersection of Campus Drive and Galvez, you see these 4 gigantic tents on the parking lot there, and one of those is a place where we're doing ambulatory outpatient testing for rapid responders, for firefighters, for police officers, for EMTs. People who don't have the option of sheltering in place or working remotely, people who are on the front line every day. And working with their health officers, we're providing rapid testing when they may experience symptoms that could indicate a possible infection with the virus. We want to continue to look at how we can expand our testing. We just had a task force that made some recommendations in that regard that involved input from staff and faculty, and we'll be implementing those recommendations and continuing to scale up testing capacity for the virus as rapidly as possible. Also, as Bonnie mentioned, we're looking at antibody-based tests, so-called serological tests, in order to identify people who have been affected but developed antibodies. That should give us a better understanding of the prevalence of the infection in our region, and also ultimately will help us get an answer to the question as to whether or not those antibodies confer a resistance to infection of the virus.
Okay, great, thank you. As we talked about last week, PPE is a huge topic, and not only the supply of PPE, but what PPE to use. Bonnie, as you know, the CDC has changed its guidelines, or iterative changes in their guidelines over time, and now universal masking is the recommendation. What is Stanford Medicine doing to address this?
Yeah, so we continue to monitor the situation that the CDC puts out on a daily basis, and actually more than once a day, because they are also trying to decide what the best way is to protect all of us and our patients as well. And so we have recently gone ahead and recommended that people mask, patients and providers will mask in a healthcare situation, and that people who are not patient-facing and can't socially distance should also be wearing masks. These are surgical masks. Obviously, we have a much more tiered approach for procedural issues for healthcare providers, including staff as well as physicians. And those guidelines are very detailed, and you can find those on all of the different intranet sites that are posted through the Stanford Medicine main website. But I want you to be rest assured that we are following, at a very minimum, the CDC guidelines, and frequently are going beyond that, with the input from all of the key stakeholders across all of the Stanford Medicine institutions, so that all of our staff and faculty and facilities providers are all able to weigh in on what they think are the important issues for their safety, and what we know about the protection that we use, the PPE that we use, that makes us safer and safer as we see the number of people in our community, the number of infected people in the community going up. And so those are the changes that we're responding to, is the number of people that we may be coming into contact with. So yes, our recommendations have gotten a little more strict as we have seen the disease spread more throughout the population, especially those that are coming obviously to the hospital and the different facilities around the Bay Area that serve Stanford Medicine.
Okay, great, thank you so much. So now we'll turn to some live questions. Let's see, Bonnie and Lloyd, is there any idea on when testing may be available for asymptomatic community members? Many people are infected with COVID-19, will be asymptomatic but shedding virus, and obviously this is really worrying the community.
Yeah, so that's a great question, and I think a lot of us are really eager to see how this serologic test gets rolled out. We want to be cautious and make sure, first of all, that it's valid, it's FDA approved, and that should be coming soon. We also want to make sure that we think carefully about how to use this resource, because at least in the initial days, the resources and the reagents will be somewhat limited, and we want to make sure we address the highest priority questions first. One of the things that we're also doing right now is we've already started implementing some studies to look at shedding in households and communities. So we can actually use the PCR test that we have to identify the virus. So we are starting those studies to at least see who might be infected now in the community, who may not have symptoms. Those are already underway. But adding the serologic test will make those even more powerful, and we hope to get those started pretty rapidly with a tiered approach, so that we make sure that we do answer the most important questions first, and utilize those resources wisely.
Okay. Anything else to add, Lloyd?
No, I think Bonnie's summarized it really well. As we've said, these recommendations evolve in real time, and as we learn more and have greater testing capacity, we will certainly make available as many tests as we can, and in a variety of different ways. The other thing, to follow up on something that Bonnie said, because the RT-PCR does depend upon a certain level of viral load, maybe Bonnie, you can comment on its utility in asymptomatic people and what we can expect to see if and when we're able to roll it out more broadly to asymptomatic people.
Yeah, so we have early data now that we're hoping to publish soon, showing that people who have, and others have started to do some similar studies, that the peak of the viral load, or the amount of virus in primarily in your nose or mouth, seems to peak early on during the symptomatic period. So we do think that people who don't have symptoms do have some degree of likelihood of shedding virus, but we think those people are less infectious. We also know that over time the level seems to drop off fairly rapidly. So we're using that. We're going to try to understand how well we can monitor at a population level when people, for example, can go back to work, when we know people who are immunocompromised are less at risk for being exposed, and other parameters that we'd like to follow. So we're learning more, and we will continue to study this.
Okay, great, wonderful. David and Paul, it has been announced that most Bay Area schools will not reopen this school year. How are we planning to address the needs of staff who now have to stay home and take care of their children?
Let me start and share a few comments, and then Paul and I both, as Paul shared earlier, we're really working toward what can we do together across our healthcare enterprises. And we know that it's challenging when you're here at work and having to be here on shift and you have childcare needs at home. I will say, though, I have been incredibly impressed with our staff who are here. In fact, as we look at those folks who are having to call off and not be here, that's even reduced a bit since this has occurred. So we know that our staff are very dedicated. We've tried to provide a number of different perspectives where you can care for your family and make sure that your child is getting the care they need. That includes not only more flexibility in the time off pay that is being provided. We've also done some things that probably Paul can share a little bit more detail, but financial support for childcare, and even the companies that we've been working with locally to provide childcare in the cases of those. But I think there's a lot that's being done, but we certainly know this is something that's creating sometimes a hardship for families to be able to balance, but we appreciate all that's being done by our employees to make sure that they're here to get the care that our patients need.
Yeah, and just supplementing what David just shared with you, the other thing is we found that many of your children are stars as we do more meetings by Zoom. So many of our employees are working from home, and we think that also will help during this time when schools are closed and daycare is more limited. But as David said, we also do provide some support for our staff through various time off banks, as well as some child care opportunities that they have as benefits as well.
Excellent, excellent. I also understand there's availability for pet care, which is particularly important for me, so I'm very happy about that. Thank you all for joining us here today. This is our fourth installment of the Stanford Medicine COVID Town Hall. We'll see you again next week, but at this point I'd like to ask Lloyd to provide some closing comments as we move into week number 5.
Well, Andra, thank you again for hosting us today and guiding us through the questions. And to all of you who have given a bit of your time here today to share your questions and receive some information from us, thank you very much. And to everyone in Stanford Medicine and our broader community, the university and our region, thank you for your patience, for your persistence, and what you're doing to help us all get through this together. I'm confident that because of our people, we're going to get through this together, and we're going to emerge, as Paul said at the beginning, a different organization, but an even stronger organization. Thank you.
Thank you.